If you're contemplating having cubital tunnel release surgery, let's go into the truth about what to expect after that surgery. My name is Huang. I'm an occupational therapist and certified hand therapist, and I've treated hundreds of people with cubital tunnel release surgeries and also helped them avoid it as well. So, here is the truth about what to expect after the surgery, and then I'll also share with you my perspective about what you can do to avoid it if that's something you're interested in. So, when it comes to cubital tunnel release, I'm going to just talk about the most simple procedure because there's several different procedures depending on what you need, but I'm going to talk about the most simple one. The most simple one is basically if your nerve is being choked and compressed, right? And it's being choked and compressed right here. So here are the two bones that ulnar nerve sits along, right? And we have various types of connective tissue that just holds it in place, and you're supposed to be able to bend your elbow and move it, and that nerve is supposed to kind of shimmy a little bit as it gets moved through that tunnel, right? So when it comes to having a surgical release, all they do is say go in and they slice away those bands, those restrictive fibers that like hold everything. So it's almost like, oh, you get a release. Imagine if you at Thanksgiving overate and you're wearing jeans. You unbutton your jeans and you're like, right? So that is pretty much like a cubital tunnel release. They're just unbuttoning those tight little pants, and now your nerve gets to breathe and glide a little bit more freely. The great thing about cubital tunnel release is that you really don't have precautions afterwards, meaning, well, you didn't break a bone, so you don't have to stop moving. You didn't cut a muscle or a tendon, so it doesn't stop you from moving. You didn't cut the nerve, so it's not going to stop you from moving. All it did is sort of release how tight it is. So that usually means that you're allowed to do a lot of stuff. You're allowed to do movements. You're allowed to move. The thing is, they just want you to be real gentle at the beginning. So at the beginning, you're going to have this bulky dressing. It's going to be real thick, and it's going to stop you from essentially bending all the way. Um, and that just allows that scar. So you're going to have a little scar. It depends on your surgeon how long that scar is, and it also depends on how much compression you have that they had to kind of cut and release. But usually it can be, some surgeons do a really small incision and some surgeons do a really big incision. It just depends on your surgeon. So, but it doesn't matter how big or how small, it's still going to hurt a little bit. So that's just what happens when you have surgery. There's going to be a certain amount of pain, and you're going to feel like every time you straighten out, your skin is going to squish, right? So it's going to hurt because it gets squished. And then every time you bend your elbow, it's going to stretch. So you're going to feel the tension of the stretch. Technically speaking, you're allowed to move, and you just want to move real gentle, right? You don't want to take your arm and pull and push it. One thing I do is I teach my patients to move real gentle is using gravity to help you. So if you're laying down, so pretend like you're laying down in bed. All you do is you bring your shoulder up, and then you can gently let gravity bring your arm down and have it touch your head. If it touches your head, it's bending a certain way, right? And then you can bend it to touch your nose, and then your chin, and then eventually to your ear. And that's going to just slowly bend your elbow, and it's going to stretch out your skin. And then when you're laying down, you can just let gravity pull it straight. So that's just one easy way of just slowly, gently moving it. You want to do that gentle, slow moving for the first 2 weeks because your incision needs to heal for 2 weeks, right? Usually when they cut, the cells of the cut start to come, and they're sewed together, right? But those stitches take about 10 to 14 days to fully heal, and your skin takes about 10 to 14 days to fully come together. And then once your incision is healed, then you can move as much as you want, right? As much as you want, and also as much as pain allows you to tolerate. So the first few days, they'll probably tell you not to get it wet so that the incision gets a chance to heal, usually about 5 days. And then you're probably going back to your surgeon to do what's called a post-op check, so between 5 to 7 days, and then they're going to go and they're going to change your dressing, and everything looks great and dandy, and you have circulation, you have the way I tell my patients that that the surgery was successful and you want to know essentially right away is most people go in because they have numbness and tingling. So if the compression is causing that numbness and tingling, as soon as they decompress it, it's like unbuttoning the pants, right? You can breathe. Well, so that's the same with your nerves. So you should feel that numbness go away right away. And that's how you know, like, man, that was pretty successful surgery. And then you're just waiting for the incisions to heal, and then by the 2 weeks you can, once it's healed, you can massage it. So I tell my patients, you don't have to be really aggressive with the massaging. This is a very sensitive area of our skin. Like on the outside of your elbow, your skin and your tissue is a little rougher, it handles a lot more. On the inside is a little bit more sensitive, the skin is softer, the skin is thinner essentially. So once your incision is healed, you can do what's called scar massage, right? Or if you feel like you're really swollen there, you can massage it to help with the swelling. And all I do is I put a little bit of cream, a little bit of lotion. Cream is nice because it lasts, like you can massage longer because it's got like a little bit of oil in it, versus lotion should be water-based. So the first ingredient is water, and it just gets absorbed into your skin faster. So there's no right or wrong. Use what you have, and you can put a little bit on and you can just start massaging, right? And you can come downward, right? You can come downward, and then you can also come across that scar, right? And I always tell people, like when I teach my patients, don't just stay where the scar is. Don't just rub the shit out of the scar just because it's there. Go around it too, because just because they cut you there doesn't mean the area surrounding it is not affected. Of course it's affected. So you can work that whole area. So you take the whole hand and you can work the whole area. And then remember, your skin moves in every direction. So it's not just up and down, it's side to side as well. So you can essentially move your skin from side to side. And I always say, like, your elbow, it has this extra skin, right? And it has this extra skin because every time you bend it, it has to stretch all the way out. So what happens is it can get really tight. And so you can definitely massage that. It's all just skin and fascia underneath. So you want to take it and you can pull it down and massage it. Like going down, you can go up, you can go to the side, you can go to the other side, whichever feels good. It's just going to loosen up the scar. It's going to loosen up the skin and loosen up the fascia underneath. It's just going to make it so that it's easier for you to move, right? And then after the first 2 weeks, then the second 2 weeks, you can make sure that you're moving it better. And with the elbow gets really tricky because it doesn't want to always be straight. So if you think about it, your elbow, natural cadence of your elbow, when you're just standing, has a slight bend to it, right? This is natural. This is in everybody. Nobody is standing like this. Nobody is walking like this. It's an episode of Seinfeld that makes fun of people walking like this, because no one does that. So what happens is when you have surgery of your elbow, sometimes you can get really tight trying to get that last little bit. So I always tell people, hold behind your elbow and try to get the last little bit of your what we call elbow extension to make it go all the way straight. So if you can take a look at my elbows, I have what's called hyperextension. So my elbows goes beyond zero. Like this is zero, my elbow goes beyond zero. So if you're like me and you're loosey-goosey and your elbow goes beyond zero, you want to get beyond zero so that you can get back to what your body's normal is. And then you want to be able to bend it, right? And during these last 2 weeks, you want to get as much full motion as possible. So I should be able to bend my elbow, push on my elbow, and it shouldn't hurt. right? That's what you want. If you want full recovery, you have to get full motion. That's it. The truth about cubital tunnel release surgery is that you don't have any precautions. And if this cubital tunnel release is your only problem, there should be no reason why you're not getting 100% recovery from this, right? If it's at the elbow and you had the surgery, just to your elbow. This is different if you have a cubital tunnel release due to other injuries of your elbow. So people, I've worked with people with some of the worst, fractures and injuries to the elbow. And because of their bony structures and the fractures and stuff like that, their cubital, their ulnar nerve gets restricted and compressed. That's a whole different recommendation, because it depends on the severity of the cubital tunnel, like the ulnar nerve compression, and also depends on the severity of the fracture. So the truth about cubital tunnel release is I'm talking about the most simple release and the most simple chronic issue, right? That there should be no reason why you're not able to get 100% recovery and get full motion. If you're not able to get it within the first month, get professional help, right? If you're overly sensitive, if your nerve is so irritated, get professional help, because if you're too aggressive with the nerve, it's going to get irritated. If there's other problems along that nerve, because remember, the ulnar nerve comes out of the neck, down the shoulder, and down the elbow, down the wrist. So if you're irritated, so after a month's time and you haven't gotten that full recovery, I do recommend getting professional help to find out like what's causing that, because the truth about cubital tunnel is that a lot of times I think that everyone could benefit from like 1 or 2 sessions, right? But sometimes surgeons, because it's a relatively easy surgery, most surgeons are like, because it's an easy surgery, you can recover on your own, right? But truth is, not everyone can recover on your own. If you do what I'm telling you to do, it's the first 2 weeks to start gentle motion, the second 2 weeks to get more motion and to work on your scar and your swelling. And if you're able to do that on your own, then do that on your own. But if after a month you're still having issues, don't wait and wait and wait, because a stiff elbow becomes a very difficult thing to work through, right? Then it takes longer and it takes more therapy. So it usually doesn't happen, but I believe in a bell curve, and there's always about 20% of people who have a cubital tunnel release that just ends up having more issues than majority of the people, right? But sometimes that's people's body's recovery. Don't be so hard on yourself, and just go into a trusted occupational therapist, certified hand therapist, and get the help that you need so that you can get 100% recovery, right? Now, the truth about cubital tunnel release surgery too is that you can actually avoid the surgery, right? You can. I've worked with enough people to know it's possible to avoid the surgery, and it always depends on how, like, when you come in for the actual help. And so here's the 2 things that I look for when I'm talking to people who potentially are going to work with me. I tell my patients, one thing that we're looking for in therapy is, can we reduce your symptoms, right? Can we reduce your symptoms? The second thing that we're looking for is, can we keep it? Because we should be able to see relatively quickly if you have a simple cubital tunnel type of issue, and we look throughout the whole arm. And I'm not like only looking at your elbow. I'm looking at the whole arm and saying, okay, where potentially is that problem? Boom, boom, boom. And I say, okay, well, I can actually, based on what I see today, I can help you. We're going to look for 2 things. We're going to look for, can we get rid of your symptoms, right? And that should be X, Y, and Z depending on your severity. And what you're willing to do to work together, right? And the second thing we're looking for is, can we keep it, right? If we get the symptoms, then we're looking for how long can we keep those symptoms, right? I think a lot of times people, when they're dealing with injuries, they get to about 75-80% because the reduction in pain symptoms, and then all of a sudden, because you already feel a certain amount of good, you stop working to get that 100%. And sometimes there can be a little backsliding. So it's not that you can't keep it, it's just that there's a certain amount that you have to keep working until you resolve the problem completely. Know what I mean? So, so yes, so that's essentially what you can expect after a cubital tunnel release. It's very safe. It's, it can be a quick recovery, but the truth is that you can also avoid it. And if you're interested in looking in terms of avoiding it, and you're in the local Miami area, my name is Huang Tran. I'm an occupational therapist and a certified hand therapist, and I have my clinic here in Miami, Florida, called Hands-On Therapy Services. And if you're having some of these cubital tunnel types of issues, numbness, pain in your hand, give us a call and see how we can help you. If you're not in the local Miami area, I hope this video gives you some insight into what you can do to, one, what to expect from the surgery, and two, know what to look for if you're trying to avoid the surgery. And just look in your local area and find a trusted occupational therapist or certified hand therapist that can help you. All right. Thanks so much for tuning in. And if you like videos like this, please click subscribe, like it, share it, and let me know if you'd like to see more videos like this so I can create it for you. All right. Thanks for watching and sharing. I will talk to you next time. Thanks.